Perimenopause can be unpredictable, confusing, and frustrating. The fluctuation in your hormones will manifest as changes in your body that can start in your late 30s and for some women even earlier. How can you identify those changes and know if they're due to perimenopause? My name is Claudia, I'm a 45-year-old nutritionist and holistic perimenopause coach with a master's in human nutrition and dietetics, and I help women in the 40s to reclaim their energy and feel and look their best while navigating perimenopause and menopause. One of the more typical signs of perimenopause is changes in your menstrual cycle. Your period might become heavier and more frequent, or it could become shorter and lighter, or go MIA for 1 or more months and then return unexpectedly. For some women, their menstrual cycle first becomes heavier and closer together before they start to space out. However, changes in your periods, especially if experiencing heavier periods, could signal illness or infection. And it's recommended to visit a doctor to rule out potential endometriosis or uterine fibrosis. Heavier periods can also lead to anemia, so it's crucial to have regular blood work done to check out iron levels. Unexpected and rapid weight gain, especially all around our waistline, is another frustrating symptom of perimenopause. In my case, it appeared especially on the sides of my back. Awful. However, if the symptom is accompanied by fatigue and tiredness, it might be caused by an underactive thyroid. So make sure to speak with your doctor and get tested. Hot flashes during the day and night sweats are common symptoms of perimenopause, as are hair loss and thinning hair. Simultaneously, these can also be symptoms of an overactive thyroid. So again, consult with your doctor about these concerns. During perimenopause, our general PMS symptoms might intensify. Painful breasts, cramps, bloating, headaches, mood changes, and depression can become more acute, or you might experience some symptoms you never had before. Vaginal changes, insomnia, mood swings, body aches, and joint pain can also signify perimenopause. There are over 30 symptoms that can indicate the beginning of this transitional phase towards menopause. So how can we know for sure that it's perimenopause? Can a blood test provide answers? It seems like it's not that straightforward. Experts like OBGYN Dr. Mary Claire Haver explain that there is no blood test to determine if you are in perimenopause, as the hormone levels fluctuate too much for one single blood test to be diagnostic. Also, depending on what time of the month we do the test, our hormone can look very normal. I have friends who underwent blood tests and were told by their doctors that everything was okay. But typically, doctors use this blood work to determine if one is in full menopause. And there is a difference between perimenopause and menopause. If you feel you should know more about perimenopause and need guidance on how to navigate this phase of life, I have a guide for you that you can download for free from the link in the description box. Now, the best way to determine if we are in perimenopause is to track all our symptoms along with our menstrual patterns and present this information to our healthcare provider. I will soon host a live mini workshop where I will discuss perimenopause symptoms more in depth, and I will share some tools for effectively tracking your symptoms and discussing them with your doctor. For more information and to sign up, use the link in the description box. Meanwhile, I encourage you to be open with other women around you. Foster a supportive space to share symptoms and experiences. It's also crucial to communicate openly with your partner to ensure they understand what's happening with you and your body. All women go through this phase, but unfortunately we don't talk enough about it. Some of us might be embarrassed by symptoms like urinary incontinence and suffer in silence, thinking no one else in the world is experiencing them. It's important to know that some women suffer from more symptoms, while others might barely notice any. But we are all in the same boat, and nobody should have to suffer and feel miserable because there are options. The right lifestyle modifications can make a huge difference in your perimenopause journey, especially if you start to apply them as early as possible. So I recommend you watch this video next about 8 mistakes you can't afford making during perimenopause. And if you need personalized help to navigate perimenopause and create the best lifestyle for a healthier and symptom-free menopause, you can work with me through the link in the description box. Thanks so much for tuning in e ci vediamo nel prossimo video. Ciao!